Hello and welcome back to All Round Health Talk. This week we're focusing on answering the questions that we received from our viewers. Last week we started answering some of the questions, and so we're going to continue with answering more questions this week. So let's go straight to the questions. We have a question from a viewer that says, can I take antibiotics with antiviral medications? Well, basically, people can have a bacterial infection or start with a viral infection and then end up with a bacterial infection. Now, most of the viral infections do not require specific treatment. You treat viral infections with symptomatic treatment, which means that if you have a viral infection and you have headache, you have to take something for the headache, and if you have a fever, then you have to take something for the fever. So basically, viral infections do not have a specific treatment. Now, obviously, there are some viral infections like herpes, chicken pox that have treatment, like antivirals that are required to treat those viral infections. Now, if for some reason you have a viral infection that requires a specific antiviral treatment and you come up with a bacterial infection, you can take antibiotics and antiviral medications together. Now, definitely your doctor is going to always tell you if the antibiotic you're taking is going to interact with or interfere with the function of the antiviral he's giving you. So generally you can take antibiotics with antiviral, and most of the viral infections do not require antivirals. And we remember that antibiotics are medications that are used for bacterial infections, and antivirals are medications that are used for viral infections. So always let your doctor know if you're taking other medication. For example, if you're taking some medication for some other infection or for high blood pressure or something else, always make sure that you specify all the medications you're taking so that your doctor will be able to give you the adequate medication that would not interfere with the ones you're taking. In the case that you really need to take that medication and it interferes with what you're already taking, your doctor is going to tell you to suspend what you're taking until you're done with this with the medication he's giving you for the infection. So always it's important to let your doctor know if you're taking any other medication, but on a general level, you can take antibiotics with antiviral drugs. Next question says that what are the normal values for the blood pressure and how can I take care of myself to prevent high blood pressure? So we had a video where we talked about high blood pressure. In that video, we spoke about the different classifications of the high blood pressure. Generally, a normal human being is supposed to have a blood pressure of about 120 over 80. Then you can have 125 over 82 and all that. But based on classifications that are recent, once you have a blood pressure of over 130/80, we begin to say that you have pre-hypertension. Now, this obviously doesn't mean that if you take your blood pressure today and you have over 130, maybe 135, 82 or 84, it doesn't mean that you are pre-hypertensive. But if on a frequent basis, when you take your blood pressure, you keep coming up with blood pressure that are within that range, then we say that you're pre-hypertensive. Doesn't mean you have hypertension, but it means that you probably have a risk of having hypertension. So you would have to begin to take care of your diet, your lifestyle changes, basically just lifestyle changes, no medications. Now, when you have a blood pressure above 140/90, let's say above 140/90, you're hypertensive. Now, obviously, this is not just at the first instance you take the blood pressure. There has to be successive control of your blood pressure to confirm that you're actually hypertensive. So if you have a blood pressure of 140 to 149 over 90 to 99, you're in the first stage of hypertension. Now, if you have over 150 to 159, if you have 150 to 159 over 100 to 109, you're in the stage 2 of hypertension. Now, when you have over 160 systolic blood pressure, over 110 diastolic blood pressure, then you're in the stage 3. Now, based on what stage you are, your medication will vary. You might need just one. You might need one medication, a single therapy, or you could need two different medications, or sometimes 3, depending on the gravity of your hypertension. So this is how basically you classify high blood pressure. Now, it's important for you to know that if somebody in your family, be it your mother, your father, or some close relative has high blood pressure, your risk of having high blood pressure also increases, which means you have to take care of your health, knowing your family history. So number 1, for you to be able to prevent hypertension, know your family history, know the diseases that are in your family, and know your risk of having those diseases. Number 2, you would have to maintain a very good diet. Diet in this case doesn't mean that you have to avoid this food, that food to look sexy or beautiful, or like the diet the models go on. That's not what we're talking about. A diet here means that you just have to eat good food, meaning that you have to eat carbohydrates mixed with proteins and vegetables, vitamins, water. So that's what we mean. Most times, especially in Nigeria, our food is focused on carbohydrates. Now, you eat a lot of carbohydrates, but you do not accompany that with enough protein or enough vegetables. So that's where the problem is. So make sure that you're able to eat a small portion of carbohydrate and combine that with proteins and vegetables, which are really, really very good for the blood pressure. Apart from food, exercise is important. Basically, what we mean here is an active lifestyle. It doesn't mean that you have to go to the gym to lift weight or do extreme sports. What it means is that you have to have an active lifestyle. Some people have jobs that require them to sit down from the moment they get to the office till they leave the office. Now, active lifestyle means that you make out time to move around, to take a walk. So you don't want to leave your office after sitting down the whole day and go home and sit down and watch TV and eat junk. No. The idea is for you to be able to take a walk 30 minutes a day from Monday to Friday, and then you rest Saturday, Sunday. You could also go up and down the stairs. If you live in a building where there are stairs, that is a good source of exercise. Going up the stairs Monday to Friday would help you a lot. So basically, just be active. Be a kind of person that will regular checkup. Make sure you check your blood pressure on a regular basis to know where you are health-wise. Apart from that, so another way to take care of your health if you're hypertensive, or to prevent it if you're not hypertensive, is for you to take your medications for other diseases that you might have. And people who have other chronic diseases, for example, diabetes, have a high risk of also developing high blood pressure. So if you're suffering from any other chronic disease meaning a disease that has no cure, that requires you to take medication for the rest of your life. If you're suffering from any other chronic disease, it's important for you to take care of that disease so that you don't open the door for other diseases such as hypertension to come in. So that's how you take care of yourself, and those are the values for high blood pressure. So today we're just going to be answering those 2 questions, and please tune in next week for the other questions that we'll be answering. Please remember to like the video, share the video, leave a comment, send in your questions if you haven't sent in, and please share the link to others so that every other person can learn and we could all help each other. Thank you for watching. See you next week.